Hello, everybody, and welcome to the Tuesday edition of Video Clips. I'll just start with a couple of announcements. We're going to talk about prostate cancer and breast cancer, or cancer in general, in this video clip. So I'll talk about our campaign at the end, but I want to mention, first of all, that there are so many healthcare professionals who are being displaced right now for a variety of reasons. I think we all understand that, and looking for what is the next chapter of professional life going to look like. And so I'm holding a conference call on Friday, October 8th at 7:30 p.m. Eastern time, just a conference call. I'm going to discuss some of the options that are available and what my ideas about what you might do with yourself going forward. So if you'd like to participate, it's free. Just send me an email at pampopper@msn.com. So if you're a nurse or a doctor or a physical therapist or somebody who's saying, listen, I'm not going to be working at a hospital anymore, I'm going to be looking for other things to do with myself, I think there's some great things to consider, and we'll have a very robust discussion about it. All free, pampopper@msn.com. All right, so as you guys know, Prostate Cancer Awareness Month is September, Breast Cancer Awareness Month is October. We kind of lumped them together into one big campaign to get away from some of the silly ideas about what to do about cancer and talk about constructive things to do about cancer, like how about let's not get it, right? So with that in mind, I've been talking about for the last couple of weeks the limitations of screening programs, because it seems that the focus is always on catch it early instead of keep it from happening, all right? So I'm going to share with you some more data. This is not specific to breast and prostate cancer, but in cancer in general, all different types of cancer. And we'll just start with the idea that, there's a lot of debate right now about who should get screened, when screening should start, how often people should be screened. But this is a distraction from the real issue about screening, which is, does it really reduce the risk of dying of cancer? And the reason why I talk about it being a distraction is that while everybody's talking about finding it early, there's just not enough discussion about you can control a lot of what happens to you from a health perspective, including whether or not you end up with cancer. A lot of people think that genes are the primary determinant of disease. They actually are not. They have some influence, but a very small influence in most cases. It's much more the way you live your life, your diet and lifestyle habits, and things of that nature. So anyway, I'll just share this information with you. A research group at Oregon Health Sciences University in Portland reports that cancer screening has not had an effect on overall mortality, and that harms due to screening might actually contribute to increased rather than decreased mortality rates. The harms include false positives, which can result in unnecessary biopsies and treatment, and overdiagnosis, which usually leads to treatment for a cancer that would be unlikely to become clinically significant or require treatment during a patient's lifetime if left alone. And this is a very, very important point. If you need and can benefit from treatment, good to be able to get it. But if you can't benefit from it, giving it to you is all harm, no benefit. There's anything that has an effect has a side effect. There isn't any innocuous treatment out there that just only benefit, no risk whatsoever, right? So the researchers go on to say in their report that some studies show that cancer screening reduces cancer-specific mortality without reducing overall mortality, and that limitations in study design are the reason. For example, studies might not be designed to detect that reductions in a disease-specific mortality are offset by deaths due to the effects of screening, which include treatment, right? So you may not die of a particular cancer, and this is true in the case of breast cancer in particular. Ductal carcinoma in situ is not cancer, it's not breast cancer, but it's treated as breast cancer. And often a death from the treatment, which includes often radiation, you can die from the effects of the treatment. So you're not a cancer death, you look like a cancer survivor success story while you die of treatment for a condition that probably would not have progressed to a clinical stage. Cancer screening is promoted based on the assumption that early detection will lead to more opportunity for successful treatment. This then should result in lower cancer-specific deaths, which should then decrease overall mortality rates. But the Oregon State researchers say that the facts do not support the argument. They cite data from the National Lung Cancer Screening Trial as an example. Low-dose CT screening resulted in a small relative reduction in deaths from lung cancer when compared with chest X-ray, but only a tiny absolute reduction in overall mortality. Chest X-ray is now no longer the standard of care, and this change actually may have caused an increase in the risk of death from lung cancer. And the reason would be picking up even more minute lung cancer that wouldn't have killed you if left alone. The researchers also point out that the estimated 12,000 fewer deaths from lung cancer resulting from CT scanning must be evaluated in consideration of the 27,034 major complications resulting from treatment, which include lung collapse, heart attack, stroke, and death. And of course, in those situations, you don't die of lung cancer, you die of the treatment for lung cancer. So it can be quite deceptive in terms of looking at what is the real outcome, what are the data for screening and treatment and death. The researchers encourage informed discussions between patients and doctors during which risks and benefits can be evaluated along with personal preferences. And I'm going to talk about tomorrow the limitations of even being able to do that in today's medical system. So stay tuned for more on that. They wrote, quote, "Declining screening may be a reasonable and prudent choice for many people," and added that doctors should be comfortable with whatever choice people make when they hear about all the potential benefits and the known harms. And so I could talk about this for a long time. I have an enormous amount of data on screening. And there's no question that in some cases, screening can save lives, but that's offset by the majority of cases in which that doesn't happen. And so that needs to be, with the exception, I always throw in the exception is cervical cancer screening, which has reduced the risk of dying of cervical cancer in every country in which it's been introduced since the beginning. So I'm all for patients choosing what they want to do. My job is just to provide information so people can make an informed choice. So this is not a campaign to discourage screening as much as it is to encourage data being used to make choices. Now, this brings us to our campaign. We think that the best way to talk, or best thing to talk about if you're going to talk about cancer is how to prevent it. And the best way to prevent it is to be proactive in taking care of yourself. If you're lean, if you're physically active, if you're eating well, sleeping well, you're hydrated, watch the alcohol consumption. It's a cancer promoter. You're much less likely to have cancer, to develop cancer, than if you're not doing those things. So thus our campaign. If you sign our pledge that you will take better care of yourself, you get a $100 certificate, which you can use toward our courses. If you get 25 other people to sign that same pledge, we give you another $100 certificate. And we offer some amazing courses at Wellness Forum Health, and you can use those certificates to offset the cost of courses. So get busy. Write to me, pampapper@msn.com. I'll have somebody in my office send you pledge cards, materials, whatever you need. You can also go to our website at WellnessForumHealth.com, and you'll see all the stuff is there, the pledge cards, everything you need. So this is an opportunity for you to make a commitment. It's always good to do it. I sign it myself. I mean, I've been taking care of myself for a long time, but I just like to reaffirm my commitment to healthy living and maintaining health as the best strategy for having a long life. All right, so that's it for today. As usual, pass this on to anybody who you think would enjoy watching it, and I will be back to you tomorrow with more news.